that people are going to experience with the therapeutic the modalities.
All right. Do you want to do a couple modalities? Yeah, why don't you can do the laser. I'll do ultrasound.
Some of the modalities we do with the shoulder, if we're running into a really acute shoulder, the pain is it's too much for them to handle some of the other treatments, we'll try to initially work on symptom management. You know, if they're too sore to do the exercises or they just can't bring themselves through the ranges, sometimes we just have to calm down the symptoms first.
Is that from inflammation or?
Yeah, it's inflammation from the injury itself.
Okay.
So, you know, every injury has an inflammatory cycle, and sometimes you just need to break that inflammatory cycle before you can really proceed into effectively treating that area.
Okay.
So one of the modalities that we use, it's been around for a while, but it's starting to gain popularity now, is the laser, and we have been using the laser effectively on different tendinitises and bursitis. The laser is this unit right here, and it's a class 3 laser, meaning there is no thermal capacity to it. There's no heat involved with this laser, but there is a penetration that's fairly substantial. We're looking at anywhere between 4 to 6 centimeters deep of light penetration into a joint, into the tendons that we're treating. The benefit of that is the laser has been shown to increase productions of nitrous oxide, which will cause muscle to relax, as well as ATP, which is a natural component of healing. So if we can apply this modality to an area that may be too sore for someone to work with, we can help start to reduce the pain, inflammation that they're experiencing at that joint that can then allow us to then progress them further.
So what does your experience tell you that the average person, how many treatments might they get with a laser treatment before you see that progression?
I mean, it's really patient-specific, and it depends a lot on the acuteness of the injury, the age of the patient. There's lots of variables. We have used it on different patients, and we'll see differences within the first 1 or 2 sessions, and sometimes it's more of an ongoing thing where we'll use upwards of 8 to 10.
Okay. And that's how long is that treatment? Just a few minutes, or?
Yeah, it's a short treatment. It depends on the amount of joules you want to administer to a site. It's a non-mobile treatment, so you would start at one site and you would allow the dosage to go in, and you would then continue to move it after each time segment is over. So yeah, maybe 3 or 4 spots. The total treatment time on that would be approximately 5 minutes or so.
Okay. And then what might they see? What's another one?
Well, right behind Andy we have ultrasound. Ultrasound would be a form of deep heat. Okay, we're using sound waves that go in 3-5 centimeters deep that can produce heat, and that's done through a cellular level, almost vibration that produces friction, and that friction produces heat. Some of the benefits of that would be increasing, blood flow to an area. Say if you have a calcification starting to happen on a tendon, that can help increase that blood flow to that particular area, maybe increase the pliability of that tissue, which will allow us to stretch them out a little bit further. That increased blood flow will also, speed up the healing process, and it may make it a little bit easier for them to go through some of the stretching later on.
Okay.
And then what we have here is iontophoresis. So this uses an anti-inflammatory medication. Typically what we'll use here is dexamethasone, and you can use other things as well, but dexamethasone is the medication that we use here, and it has it's in a solution that has a negative charge to it, and we'll use it with an electrical stimulation unit. So the medication gets it put on this patch. The patch is then adhered to the point of irritation. So then we hook up the negative electrode to that patch, and the positive electrode is hooked up to a dispersal pad that's put somewhere else on the body, and that just basically completes the circuit.
So it's like charge, so in other words, like charges repel, and it's forcing it into this tissue.
Like size of magnet, they'll repel and push against each other, and
cool.
it drives the medication into that spot. So essentially, it's like kind of like a cortisone shot without the needle, but it is a little bit more diffuse. It takes a few more treatments than just one shot to get it through to its full extent.
So, how long does that take to administer the medication?
It depends on the person's tolerance to the electrical stimulation. Sometimes people don't feel it at all. Other times people will experience a stinging sensation that becomes more intense. So then we'll have to turn the unit down, and that will lengthen the time that it takes to administer that particular treatment. So typically it takes anywhere between 15 and 20 minutes to fully administer one of those treatments, and we'll do about 6 or 7 of them. And at that point, you probably experience the full benefit of that iontophoresis.
We also have the ionto patch.
Yeah, patch.
There is a patch that we can use for people with more sensitive skin. Because that is a direct current, sometimes the skin will be irritated with that particular unit. In cases like that, could be elderly, could be thin skin, there is a patch that has a battery in it, which in essence does the same thing as the machine. It just does it over a much longer span of
Just
time.
gentler?
Yeah, it's the same dosage, but administered overnight, 12
Okay.
to 14 hours, as opposed to trying to get that medication pushed in a 15-minute span of time.
Okay.
So same dosage, longer duration of treatment makes it much more comfortable for some people.
So if I'm coming in here with a shoulder injury, and let's say we're past the evaluation, I'm going to start treatment. How long might my treatment be?
Again, that's all patient specific and how well they're doing. Some people respond very quickly to a treatment. Others, because of different variables, including age, prior condition before the onset of this issue, maybe a lot longer. But again, typically we're going to see results within the first 3 weeks, and that could be anything. We're looking for decreased pain, obviously, but we're also looking for maybe intermittent pain, where the pain level stays the same, but they're getting it less frequency.
Okay.
So we'll look for stuff like that. But I mean, treatment times and durations will vary between anywhere from 2 weeks to some people 12 weeks, and if it's a post-operative case, that can be even longer, 16 plus.
How about my visit time? How long would each visit be? And I know there's probably some variability there, but how about the averages there?
Yeah, like you said, there is variability, but I mean, we typically will see someone for at least an hour, depending on how many exercises they have and what our goals are and whether or not we accomplish those goals in that day. So when you add up the time they're on the heat, the exercise time, the manual hands-on treatment that we're going to make sure that they get because they can't do those things at home, as well as different modalities that we'll use. I mean, we've had people in here an hour and 15 minutes, hour and a half.
Mm-hmm.
We just want to make sure we accomplish our goals, make sure we get them better. So there is no time. We're not going to time anyone, but usually between an hour and a half.
Okay. And do most shoulder rehab cases, are they sent home with regimens that you're expecting them to follow through with, the exercise plans, that kind of thing?
Yeah, I mean, that's a huge component of the treatment. I mean, people are here maybe an hour 3 times a week. They're home 24 hours 7 times a week. So there's a lot of rehab that takes place at home. So after Andy does his evaluations, he makes sure they have a couple exercises to take home with that day. And as they progress, and as we see that they're independent with those exercises, we'll then continue to add to their home programs so that they can become almost their own therapist eventually, that they can self-manage this problem at home. I mean, that's our goal, to get people independent with their exercises, to help manage this problem at home and just prevent it from coming back.
Well, I want to thank you guys for coming in here. I appreciate it. Brian Faghan and Andrew Burke from Long Pond Physical Therapy talking about shoulder problems. And again, thank you for watching another episode of Health Naturally.
Thanks for having us, Paul.
Yeah, thanks, Paul.